And we're back. Okay, guys, this is Mrs. Sager again, and right now we're going to learn how to add medications to medications to an IV fluid. So what we want to do is we want to check the orders, obviously, because you can't do anything without the orders, right? So you check your doctor's orders. You make sure that you have the right medication. This says regular insulin, guys. We're going to pretend that this is potassium, okay? So we're going to add potassium to this normal saline bag right here. And what we want to do is check the order, and our orders state to add a certain amount of potassium to that. So what we're going to do is draw up that certain amount of potassium. It doesn't matter what that is right now, guys, okay? You're just learning how to infuse it into the medicine, okay? So what you're going to do is you're going to get your vial ready, pop off the top, clean off the vial with your alcohol. You're going to instill air into your needle, push it into the vial, push the air in, turn the vial upside down, and draw out the recommended amount that you need. You'll have to do the math prior to. So now you have the amount that you need for infusion into the bag. Now remember, before we had this blue that we took off in order to spike the IV fluid tubing. This one is your injection port, okay? So what you want to do is you want to take and wipe off your injection port with alcohol, and then you're going to very carefully poke your needle into there, okay, and instill your medicine into the bag. Okay, push it all in, and then you're going to put your safety device up on your needle, right? And so then you just want to basically rock your fluid back and forth. Don't shake it. Don't do this, because that makes air bubbles. See? You don't want that. So it's just a slight little rocking back and forth, okay? Now that we've done that, do you see that there's writing on this side of the bag? This tells us what that fluid is, right? If we go over on the other side, it's plain. That's where we want to put our sticker. We're going to put a sticker on here to tell us what kind of medicine we added to the bag, what date and what time, and who did the adding. So you're going to have, now this will vary per your facility. It'll look just like this. You'll have to put your patient's name, the room number, the drug, the amount that you put in, added by, this is going to be your initials. Your base solution is going to be whatever it is on your bag. Okay, so this is normal saline. And then the date and time that the medicine was added to the bag. You're also going to put down your start time. What time are you starting this medication into this patient? What is the date that it started? And then what is the flow rate that it's going to infuse into the patient? Why is this important? This is important because with secondary lines, well, with any IV solution, there's a certain amount of time that the fluid can be hanging before it has to be swapped out for new medicine. And with a secondary, and this is called a secondary line, okay, with a secondary line, that can only hang for 24 hours. If the infusion is not done within that 24-hour period, it has to be stopped and new medicine has to be instilled into the person. This is to cut down on the rate of infection. We don't want, the person to have a systemic reaction within the vein from, stagnant medicine. So we want to change that out. So you would fill it out. We're just going to put Smith, and we're going to put room 201, and we added potassium. So you can either write the potassium out, okay, or you can use that K with the plus sign. That means potassium, right, guys? And let's just say that we put in, I'm trying to think, your amount. And then added by, put your initials. I'm sorry, I'm drawing a blank right now. It's the old brain, guys. My base solution is normal saline, and the date is I don't know if that's the right, but that's okay, 2/11/15, and the time is, let's say, 1300. And my start time is going to be 2/11/15. And I put that in the wrong spot, but that's okay. You can go over here and put the start time here and put 1300. People can see that it just got transposed. Don't flip out about that, people, okay? Just continue on. And your flow rate is going to be 50 milliliters an hour, okay? So what you do is you fill that all out. You take off the sticker from the backing, like this, and it's a sticker, okay? And then you just place it onto the bag, like this, and now this bag is telling people that, oh, wait a minute, that's not just normal saline, okay? That actually has a medicine added to it. And that's how you do it.